Dumfries and Galloway Health and Social Care Strategic Commissioning Plan (SCP) for Health and Social Care from 2022 to 2025. Consultation May 2021 to August 2021. This document includes 1. Introduction 2. What we are trying to do 3. The model of care and support 4. What we plan to do over the next 3 years 5. How we are going to make it happen 6. Challenges or things that can make it difficult 7. Tell us what you think. (1) Introduction. We call the Strategic Commissioning Plan for Health and Social Care the SCP. It is being developed for the Dumfries and Galloway Integration Joint Board (IJB). The IJB have the responsibility for a lot of the health and social care delivered to people across Dumfries and Galloway. The IJB has to update their old SCP or write a new SCP for health and social care every 3 years. The Dumfries and Galloway IJB is made up of people from the NHS, Dumfries and Galloway Council, and the third sector and independent sector organisations. They are working together to plan health and social care and support. The third sector includes voluntary organisations, for example, charities, carers, support groups, and lots of community groups and organisations. The independent sector includes some care homes and care and support providers, as well as some support organisations. Looking back at what we have done over the last 6 years. We have looked back on what has been achieved since the first SCP. We have listened to what people have said. People have told us that a lot of good things have been achieved. People told us how they thought things could be better. Looking forward to the next 3 years. People have worked together to help plan how health and social care will be provided for the next 3 years. The first draft SCP for 2022 to 2025 and this easy read version of the SCP explain how that will be done. Who the SCP is for. The SCP is for every adult and young carer who lives in Dumfries and Galloway. It explains how we will work together to deliver health and social care and support. How we put people at the centre of all that we do. What things are most important. Why we need to change how we do things. What we will do to support people to have happier and healthier lives in Dumfries and Galloway. Plan on a page. We have made a summary of the SCP on one page so that people can see how it all fits together. (2) What we are trying to do. We want everyone in Dumfries and Galloway to be as active, safe and healthy as they can be. We want to improve outcomes for people who access care and support and for people who deliver care and support. Vision Statement. A vision statement says what our ambition is. We asked people what the vision statement for the SCP should be, and this is what they decided. People living happier, healthier lives in Dumfries and Galloway. 3. The model of health and social care and support. Things such as housing, education, employment, and environment can also impact on people's health and well-being. The model shows how health and social care and support should work in Dumfries and Galloway. It is about supporting people to make decisions about their own health and well-being, to look after their health and well-being and stay well. It is about supporting people to get access to care and support based on their rights. Get care and support at the right time in the right place. Recognise how important unpaid carers, family and friends, and social support are. See how things like housing and employment affect health and well-being. Things that help us to deliver the health and social care and support. People working together. New ideas of how we can do things differently. Mobile phones, computers, tablets, alarm buttons, and other equipment. Using money to support people early and avoid crisis. A model of care and support that involves and includes everyone. 4. Strategic Commissioning Intentions, or SCIs. We have a list of 8 things we want to achieve. These are called our Strategic Commissioning Intentions, or SCIs. Here are easy read versions of the SCIs. 1. People will be supported to live independently and well in their own homes. 2. Things that make it difficult for people to access health, care and support will be reduced. 3. People's care and support is safe and works well, improving their lives. 4. People will get support early to avoid crisis. 5. The money we have will be used in the best ways possible. 6. National, regional and local priorities for care and support are achieved. 7. People are supported to look after their health and well-being in their community. 8. People who deliver health and social care and support, including unpaid carers and volunteers, are valued and supported. 5. How we are going to make these things happen. Examples of some things that we are planning to do. Home teams made up of people from all sectors will support people to live independently in their own homes. People will be able to get the information they need about their health and care. People will work together to make plans for health and social care in Dumfries and Galloway. People will be supported to use equipment that helps them stay independent. Partners will work with unpaid carers to plan health and social care and support. People living in poverty or at risk of living in poverty will be able to get support. A variety of organisations and groups will work together to deliver health, social care and support in communities. Six, challenges are things that can make it difficult. There are things that can make it harder to deliver care and support. Some examples are: more people need care and support. Some groups of people have poor health and live shorter lives. Some people have illnesses that can last a long time, like dementia and diabetes. More people are going to hospital and taking longer to get back home. More people do not have family or friends to support them. Fewer people to provide health and social care and support. Not enough houses that meet people's needs where they want to live. Not enough support for unpaid carers to help them to care for loved ones. There are fewer volunteers. Less money and people to provide care and support. Medicine and equipment cost more to buy. This is how the IJB's budget of £409 million is currently spent. The Mental Health Directorate includes mental health, learning disabilities, psychology and specialist drug and alcohol services. Seven, tell us what you think. You can help us to shape the future of health and social care and support by filling in our survey online on your phone, tablet or computer on the Smart Survey. Emailing your answers to dg.spcp@nhs.scot. Filling in the survey and posting it to Strategic Planning, Mountain Hall Treatment Centre, Bank End Road, Dumfries, DG1 4AP. Please do this by the 29th of August 2021. If you need a paper copy of the survey, please phone 01387 272734 or email dg.scsp@nhs.scot. You can ask someone to help you complete the survey if you need support. Data protection. If you need any information on how we will use your information, please look at consent. If you put an X in the agree box at the bottom of the page, it means that you have read this. You want to do the survey. You know your information will be kept private. You know your answers will be kept safe until the results are out. Then they will be destroyed. You are over 16 years old. If you are under 16 years old, your parent or guardian says it's okay to do this survey.